Thank you very much, Dr. Steve, for the introduction. And hello, everyone. I would like to take the opportunity to thank the organizing committee for the invitation. So my talk today will be focusing on the key population-led health services. And the outlines of my talks are including the definition and the framework of the key population-led health services, or KPLHS, and also I will share with you about the implementation and the examples of the key population-led health services and the successes and challenges. So this slide shows you the number of the new HIV infections by populations in Thailand. According to the Asian epidemic model for Thailand between 2005 to 2025, more than half of the new HIV infection in the country are among the male-to-male sex, which is including men of sex with men and transgender women. And here, this slide shows you the PrEP uptake in Thailand divided by each service delivery models. On your right-hand side, you can see that on the blue proportion, which is almost 60%, is actually show you the proportion of the Thai PrEP users actually came from the key population-led PrEP services, which I'm going to tell you more about the key population-led PrEP services. So what is the key population-led health services, or KPLHS? KPLHS is actually designed and co-delivered by the members of the key populations. And it's actually the defined set of HIV-related health services, which is focusing on specific key populations. And the services are actually identified by the community themselves and are therefore needs-based, demand-driven, and client-centered. And it's also delivered by trained and qualified lay providers who are often the members of the key populations. And here, this slide show you how the key population health services help fill the gaps, the service gap for key population. Let's start with the accessibility. The KPLHS is actually need to be located in the hotspots or the area where the key populations living in. And the service provision needs to be flexible according to the service and according to the lifestyle of the key population that you are serving. And the service package need to be comprehensive and one-stop. In terms of the availability, as I told you before, the service package need to be needs-based and client-centered. As for example, if you work with transgender populations, you may have to integrate the gender-affirming care or hormone treatment into your existing health service package. If you are working with sex workers, you may want to consider to include legal consultation or legal assistance, which can be provided to sex workers when they encounter with any arbitrary arrest or from law or enforcement officers. In terms of acceptability, the staff need to be members of the key population's community because they truly understand the key population lifestyle. The service need to be provided in the gender sensitive and free from stigma and discriminations. In terms of quality, the KP lay providers need to be trained and qualified in accordance with the national standard and establish the strong linkages with and high acceptance from public health sectors. Here are the examples of how you can provide the integrated services for transgender population. At the Tangerine Clinic at the Institute of HIV Research and Innovation, we actually offer the gender-affirming hormone treatment into the sexual health service package. And so far, we are able to provide more than 10,000 clinical visits to more than 4,000 of the transgender women populations who are visited the Tangerine Clinic. And you can see that we have very high HIV testing rate among the transgender women population, and we found 10% of those who receive HIV testing tested to be HIV positive. And the ART initiation rate was around 94% among these transgender women. And we can also observe the high syphilis reactive rate among these women as well. And however, we were very struggling in increasing PrEP uptake among the transgender women populations. This slide shows you about how key population-led same-day PrEP has been taken in close collaboration between KP-led clinics and public health hospital. You can see that on the graphics that on your left-hand side, if you are the client who are interested in getting PrEP, you will visit the key population-led clinics at the community-based organization. The staff will evaluate your risk and offer PrEP if you are eligible, and you will have blood draw at the clinic, and some certain lab will be outsourced, and then the blood result will be sent to the physician through the line application, which is the most online application in Thailand. The physician will then receive the blood and review the result of the blood test, and then will approve the initiation or the continuation of the PrEP to the clients. And then the CBO staff who are trained will be advised on PrEP use and dispense PrEP at the community-based organization. And then they are able to dispense PrEP based on the physician prescription and makes further appointment with the clients accordingly. And here are the comments from one of the physicians who we are working closely with. She's actually Dr. Pratana from the Nakhon Hospital based in Chiang Mai province. She said that so few clients walk into our hospital for PrEP, but there are so many people who having risk behavior out there at the CBO clinic. So she really supporting the National Health Security Office to allow PrEP service reimbursement to go directly to the community-based organization. And in light of the COVID-19 pandemic, we are able to adapt the KPLHS service delivery model. We actually developed the SOP to provide the telehealth, express services, as well as integrated self-sampling collection for chlamydia and gonorrhea. And it has been proven to be feasible and popular over this time during the COVID-19 pandemic took place in Thailand. And these slides show you about the data in the last, during 3 months in May to July 2020, which was last year. You can see that the percentage of self-sampling acceptance rate was increased over time in each month. And we have seen the 100 acceptability varied by anatomical site, which include 100% for urine collection, rectum, and neovagina. And so far, we have seen no invalid testing result. It's very interesting to see that we have seen very high positive rate for chlamydia and gonorrhea testing among men who have sex with men and transgender women. Here are the slides showing you about the building blocks of the KP-led PrEP services. It entails about the when, where, who, and what of the KP-led services entails. On your right-hand side in the red letters, it actually was adapted according to the COVID-19 pandemic. You can see that normally the routine clinical follow-up would take place every 3 months, but during the COVID-19, we have changed to 6 months. And normally the clients will come to the KP-led clinic to get PrEP, but right now we have introduced the telehealth by posting the PrEP drug through the postal delivery or to the Grab bike delivery in order to ensure that our clients has continued to get PrEP. And in terms of service package, we have introduced the express services in order to have the client spend the time spend very minimal time at the clinic and trying to avoid the contact with the staff, and also is also including the self-sampling collection for gonorrhea and chlamydia as well. And in addition to that, key population-led health services are not only contributing to the PrEP service uptake among key populations in Thailand, but KPLHS also contribute to HIV testing and HIV diagnosis. On your right-hand side, you can see that in 2018, KPLHS contributed to more than 50% of the MSM and transgender women who tested for HIV nationwide. And also 36% of the newly HIV diagnosis among men who have sex with men and transgender women in the country actually came from the KPLHS. And as you know that more than half of the Thai PrEP user in 2018 actually came from the key population-led health services as well, which has been through the 10 community-based organizations in 6 provinces across the country. And here, how in terms of advocacy and policy change that we are working closely with the Ministry of Public Health. At the bottom, we actually developed the key population-led health services training module, and the training module has actually been endorsed by the Ministry of Public Health in 2018. And then later in 2019, the community and KPLHS Ministry of Public Health regulation was endorsed by the Medical Professional Council, which include Medical Council, Pharmacy Council, and Medical Technology Council, and has been signed by the Minister of Public Health in 2019. And one of the purposes of achieving the key population-led health services is to actually working closely with the government to support and promote the domestic financing directly to the community-based organization. So we are trying to have the community-based organization or key population-led health clinic to receive the direct funding from the Ministry of Public Health and the National Health Security Office in order to ensure the sustainability of the key population-led health services across the country. And here shows you about how the clinical roles of the KP lay providers mentioned or approved in the 2019 Ministry of Public Health regulations. It has been said that KP lay providers are able to provide a certain set of services related to HIV and STIs. It includes pre- and post-test counseling, specimen collection for tests for infections, fingerprint blood collection for screening tests, reading and reporting test results. The KP lay provider can also work on referral for diagnostic tests and link to care. And KP lay provider can also give drugs as prescribed by health professionals to treat, prevent HIV, syphilis, gonorrhea, chlamydia, or other sexually transmitted infections. And this is how the capacity building, intervention, and certification processes for KP lay providers taken place under the Engage project. So starting from your left-hand side, the community-based organization will select their community members and nominate them to attend the training courses. The training courses will comprise different curriculum, for example, reach, recruit, test, treat, prevent, and retain. And after the training courses completion, they will have to get the examination, and they will have at least pass 80% of the testing score. If they pass the written score, they have to go for the practicum processes, which they have to collect certain number of cases at the clinic. If they are successful in collecting certain number of the cases, they have to be assessed for certification, and the passing score is 80%. Upon the completion of the certification, they will be granted a certificate. So the first certification will be valid for for 1 year, and the second certification will be valid for 2 years, and you will have to be extended for the next certification round in order to ensure the quality of the key population-led health services. And here are the number of the KP lay providers trained and certified under the Engage project. On your left-hand side, we have around 350 key population lay providers across the country attended the training course, and they actually represented from both projects, which is coming from USAID and the Global Fund projects. On your right-hand side, shows you about the number of 106 people who are working in 15 provinces, and they have been certified as of August last year. And here are the picture of the certificates ceremony to the KP lay provider who complete the training course and the practicum. So we organize this event in partnership with the Ministry of Public Health and USAID together with IHRI and community-based organization. So, as you know that in many countries and also in Thailand, the key population-led health services mainly serving MSM populations and leaving behind some specific key populations in the HIV responses, including transgender women. And on your right-hand side, you can see that when we conducted a small survey in Bangkok, we found that around 60% of the transgender women in the survey, they reported that they did not know about PrEP at all. And 7% reported using PrEP at the date of the survey. So it came to the point that we at IHRI had to do some intervention about the transgender women, especially for the PrEP campaign. So we have actually working closely with 7 community-based organizations to train 40 transgender lay providers, and they have been certified according to our training curriculum. And so far, they are able to provide more than 10,000 of HIV testing, and also almost up to 700 of Thai transgender women were on PrEP through the transgender-led and integrated hormone and sexual health services. And recently, at the last quarter of 2020, we IHRI have been closely working with other partners and donors to develop and design the first transgender-specific PrEP campaign in the country, and we call that PrEP in the City campaign. So the PrEP in the City campaign is actually the first PrEP campaign for trans women in the region. It is actually designed and produced by the transgender woman film director. And the campaign featured the 4 different characters of the transgender women who were selected across the country and represented various lifestyles of the PrEP use in their daily life. And the campaign's messages actually highlighted about the gain framing approach rather than highlighting on risk reduction messages. And one of the purpose of the PrEP in the City campaign was to increase the visibility of the transgender women in the Thai healthcare system. And you can see that the PrEP in the City campaign has been promoted through many public channels in the Bangkok metropolitan area. In these pictures, you can see the campaign was disseminated on the Bangkok's SkyTrain stations. And here's the showing you the messages of the campaign was disseminated at the Bangkok SkyTrain station as well. And this is the LED screen showing PrEP in the City campaign at the Asok intersection, which is one of the busiest traffic junction in Bangkok metropolitan area as well. And also our campaign on PrEP on transgender women was also disseminated through the bus wrap, through the bus lines, including 10 buses who are running across the city and especially across the community where the transgender people living in. And we also working actively through the online platform as well as social media channels, including Facebook, YouTube, and Twitters. And in conclusion, I would like to end here that the key population-led health services, which is designed and co-delivered by key population, is key in task sharing the HIV response in Thailand. And specifically to PrEP, the key population-led PrEP provision is the main service delivery model to scale up PrEP in Thailand, and it needs to be expanded throughout the country. And lastly, I would like to emphasize that the government needs to make financing mechanism available to support the KP-led health services in order to allow reimbursement at the key population-led health clinics across the country. And I would like to acknowledge the contribution and the support from the donors, funders, and the community partners, as well as other collaborators in these lives. Thank you very much for your attention and for listening, and Happy New Year to everyone. Thank you.